to 1. Some countries are getting them first and faster than others. Some are still not getting them at all, and many may be waiting until next year. My background is in tuberculosis prevention and treatment, and we have a saying that TB anywhere is TB everywhere. And the same can be said for COVID-19. The concept of fairness and equity have taken center stage in conversations about vaccine distribution and pandemic recovery plans. We are at a defining moment in public health. Let's seize this opportunity to reimagine public health and turn concepts of equity into real action. Throughout the pandemic and now, as we roll out the largest and most urgent vaccination effort in history, cities have been focal points. Their leaders are our guides. Recovery plans globally will take heed of the lessons that cities have learned to rebuild stronger health, social, and economic systems. Their efforts affirm that we can work for a world where people have equitable access to healthcare and where they are protected no matter their race, gender, sex, or where they live. Urban areas led public health before the pandemic, and they continue to serve as pathfinders. Today, we will hear firsthand examples of extraordinary efforts being made by city leaders across the world. A very warm thank you to Mayor Lightfoot, Intendant José, our partners, WHO and Bloomberg Philanthropies, and our moderator, Hannah Vaughn Jones, for joining us today in this timely conversation. I will now hand it over to two champions of the Partnership for Healthy Cities, Dr. Tedros and Mike Bloomberg.
Well, my thanks, first of all, to José Luis Castro, who is, of course, the president and CEO of Vital Strategies. I just wanted to introduce myself before we get to Dr. Tedros, and also to Mike Bloomberg and their comments as well. And firstly, really just to say a very good morning, a good afternoon, and a good evening to everyone on the line, wherever you may be joining us from. I'm personally in London. I'm a British journalist and a presenter with CNN International, and I am your host for today's Vital Talks event. So on behalf of the Partnership for Healthy Cities, which is of course supported by Bloomberg Philanthropies in partnership with the WHO and Vital Strategies, I'm so proud to welcome you all to Cities Hold the Key, prioritising equity in the COVID-19 recovery. Now, as Mr. Castro was just alluding to, we have a really exciting agenda for you all today. We are going to be hearing next from Dr. Tedros, the Director General of WHO, and then swiftly followed by Mike Bloomberg, WHO Global Ambassador for Non-Communicable Diseases, and also, of course, former Mayor of New York City and founder of Bloomberg Philanthropies. That will then be followed by a really exciting discussion with our esteemed mayors from the Partnership for Healthy Cities Network. We're going to be speaking to Mayor Lori Lightfoot of Chicago and Intendant Carolina José of Montevideo, and I can't wait to get to that. And there will also be some housekeeping, which I'll get to for the Q&A towards the end of the session, so stay tuned. A lot to get to, as you can see, and time is against us as always. So with that, I'm going to throw over now to Dr. Tedros, WHO's Director General.
Excellencies, honorable mayors, dear colleagues and friends, cities have borne the brunt of the COVID-19 pandemic, but many cities have also shown how the virus can be brought under control with the tailored and consistent use of proven public health measures. As mayors, you know firsthand the impact of deadly collision of non-communicable diseases and COVID-19. And the virus has exploited and exacerbated underlying inequalities. Many of the same risk factors for NCDs are also risk factors for COVID-19. Today, we have mayors speaking from cities that have worked on addressing some of these inequalities and risk factors through the Partnership for Healthy Cities, including Montevideo on healthy food environments, and Chicago on air quality. As you respond to COVID-19, we call on you as mayors to implement policies that ensure equitable access to vaccines, with priority given to health workers, older people, and those with health conditions like NCDs that put them at higher risk. As you recover, we urge you to include services for the prevention and management of NCDs in your plans. And as you rebuild, we urge you to address the underlying inequalities that have left so many communities vulnerable. We must heed the lessons of this pandemic, that health is not a luxury item, but a fundamental human right and the foundation of social, economic, and political stability. Equitable access to COVID-19 vaccines is essential, just as equitable access to all health services is at the heart of universal health coverage. I thank our global ambassador, Mike Bloomberg Philanthropies, and Vital Strategies for their strong support in the Partnership for Healthy Cities, which is helping to create a healthier, safer, fairer future. I thank you.
Thank you, Dr. Tedros, and thank you all for joining us today. Right now, more than half the world lives in a city, which means mayors have more responsibility than ever. And when it comes to public health, they can make a big difference. I saw that as mayor of New York City when we increased life expectancy by 3 years. And at Bloomberg Philanthropies, we teamed up with the World Health Organization and Vital Strategies to help other cities make progress. Together, we created the Partnership for Healthy Cities in 2017. And since then, we have worked with nearly 70 cities around the world on everything from reducing road traffic crashes to fighting non-communicable diseases like diabetes with proven health policies. When the COVID-19 pandemic began, the partnership sprung into action once again. Since last March, we've been helping cities meet a crisis unlike any before, and we're just getting started. As we move into the next phases of the pandemic, the role of cities will remain critical to implementing public health policies that protect all citizens, no matter where they live or what they look like, and we'll be there to help. Along the way, we hope to build a playbook for future public health crises, so when the next pandemic hits, we will be ready.
Well, my huge thanks then to Mike Bloomberg, as we just heard, and also to Dr. Tedros and to José Luis Castro, who addressed us at the start of this particular webinar. And thank you for those compelling remarks and for really setting the scene and the tone, I think, for what is such a vital discussion today. Now, in a few moments, I am going to be joined by our esteemed mayors for a conversation on this topic. And we're talking today about cities hold the key, prioritising equity in the COVID-19 recovery. I would like to just kick things off, though, with a bit of housekeeping. I know we're all familiar with Zoom now and the platform, having used it to stay connected and in conversation over the last year or so. But nevertheless, we are hoping that this will be a really engaging discussion and spark some dynamic conversation as well. With that in mind, at the bottom of your screen, there is a Q&A box, and do please use this feature to ask questions of our panelists. I know some of you have already begun doing so, and we're grateful for that. You can ask questions at any time during the conversation, and you can also tweet us using the hashtag Vital Talks as well. We will make sure that there is time at the end to put some of your questions, at least, to our mayors. Now, cities were at the epicenter of the COVID-19 outbreak, and over the past year, they've mounted a remarkable response, supporting high-risk populations and protecting the lives of those most vulnerable to COVID-19. Now, these urban centres are now facing additional challenges, of course, including how to mount equitable vaccine rollouts. The development and enforcement of equitable policies and practices is going to be paramount for the pandemic recovery. And that means not only safeguarding residents' health while implementing plans that build stronger health, social and economic systems. And we really hope that everyone participating in today's session leaves with perhaps more of an appreciation for how integral urban action and collaboration has been during this pandemic, this unprecedented time for all of us, and how integral it must be in continuing through the recovery as well. So it is my honor then to welcome and introduce the mayors from the Partnership for Healthy Cities Global Network. We're joined today by Lori Lightfoot, who is the 56th mayor of Chicago. And since her 2019 election win, Mayor Lightfoot has worked to expand opportunity and ensure inclusive economic growth across Chicago's neighborhoods. And during the pandemic, she's led a coordinated citywide response. We'll hear plenty more about that coming up. Her city is working with partnership support on new technology, identifying communities at the intersection of air pollution and COVID-19 vulnerabilities. Welcome, Mayor Lightfoot. We also have on the line today, we have Intendant Carolina José, who is the Intendant of Montevideo in Uruguay and was elected to office in September of 2020, last year. Intendant José has played a key role in the Partnership for Healthy Cities COVID-19 webinar series. Of course, this is part of that. Recently sharing strategies with other Latin American mayors on how to communicate with the public about the benefits and availability, of course, of COVID-19 vaccines. Montevideo, her city, has a long history of working with the partnership on the prevention of non-communicable diseases. So, Intendant José, welcome to you as well. I'd like to start with really a sort of a current state of play question to both of you. And Mayor Lightfoot, if I can ask you first, in your city of Chicago, what is the current state of play of COVID in terms of cases and hospitalizations and the vaccine rollout?
Well, first of all, thank you for having me as part of this important discussion, and thank you for moderating. Look, I think we're all still struggling because COVID is still very much a part of our present. We had seen a surge that started last fall in Chicago in the upper Midwest here in the United States, and it really presaged the second surge in other parts of the world. In January and February, those numbers started dropping in a very helpful way, both in cases, hospitalizations, and percent positivity. But over the last 2.5, 3 weeks, we've seen a slight upcrease. Not like we've seen before, but we're holding relatively steady, but we're not seeing the cases go back down just yet. Our modeling suggests that that will happen end of the month, beginning of May, but it makes managing in this crisis all the more challenging because the disease obviously has a plan that doesn't fit with our plans. What we've seen is a significant uptick in the amount of vaccine that we're able to push into neighborhoods. We employed a strategy of really leading with the data and leading with equity, making sure that we prioritize healthcare workers and then those folks in our city that were most vulnerable to disease and death. That strategy, I think, has worked well. We go over and above that to really go deep into neighborhoods in Black Chicago, in Latinx Chicago, that have been most hard hit, and done kind of a whole of a neighborhood approach, meaning without any barriers or restriction and dedicated vaccine going into those neighborhoods. We've seen the numbers in Latinx Chicago come down for the first time in the pandemic. And week over week, we are now getting first doses to 50% plus to Black and Latinx Chicagoans, who make up 2/3 of our population. So significant progress, but much more work to do. Obviously, the recent news regarding Johnson & Johnson has really been a blow, but we're adapting. But the bottom line here is we haven't been able to walk on this journey without really listening to our residents, going deep in our neighborhoods, really forming incredibly important, authentic relationships. We started that with something that we call the Racial Equity Rapid Response Team a year ago, when we saw Black Chicagoans dying at 7 times the rate of any other demographic. We knew that we couldn't just live with that. We needed to arm our residents with tools that they could use to protect themselves. And we've seen tremendous progress. The progress that we're now benefiting from is a result of that hard work that started over a year ago. And I really see this as an opportunity for us to build a really permanent foundational infrastructure to work on community health issues and disparities that we've all known about. We've nibbled around the edges, but now we have an opportunity because of COVID to really make significant progress and reverse the trends that have harmed too many people for too long.
It's so interesting to hear all the stats that you've just provided there, Mayor Lightfoot, and also to hear about the progress, even in light of a sort of a resurgent disease as things stand at the moment. And I want to get into the weeds of what you were talking about there in terms of local health inequities and how you're tackling that within Chicago and the makeup of your city as we get through the discussion. But let me bring in Intendant José now. And if you could, yes, wonderful, turn your video on. Thank you. Good to see you. May I put the same question to you, really, and just find out, first of all, in Montevideo, in your city, what the current situation is as far as COVID cases is concerned and the vaccine rollout as well?
Well, many thanks. My greetings to all the participants and mainly to the organizers of this meeting. As you know, Montevideo has a long tradition in health promotion. The tradition began in 1990. In fact, we were the first state agency to ban tobacco smoke in its facility, declaring our building a smoke-free space. 2 years later, our former president, Tabaré Vázquez, extended the measure to closed spaces for public use, such as bars, restaurants, and entertainment venues. As you know, regular tobacco consumption causes different diseases, cancer, cardiovascular, and respiratory diseases. And also, together with Bloomberg Philanthropies, we developed a project to reduce salt consumption in 2018. Right now, at the first measures that we take as measures Montevideo were the development of an ABC plan that initially we thought that it would be an emergency plan to fight against pandemic, but now we think that the effects of the pandemic are not volatile, so they are going to remain in our society. So this ABC plan has 5 axes: health, promoting the work, promoting gender equality, helping with food for many popular organizations that are organizing to have food, and also having interventions in territory, neighborhoods, housing, and so on. Concerning health, we are not responsible for the distribution of the vaccines, but we have 23 polyclinics in Montevideo. So we have put on the table everything to help. The polyclinics has extended the working time, and also we have created a drug fund because many other diseases are still on place. The people not only has COVID, and also we have incorporated mobile care teams, and also we have developed the creation of a support line because we are very worried about the possibility of child malnutrition. So we're trying to help even the social organizations when they are providing food, to provide food that prevent malnutrition. In this very intensive ABC plan, in which we are working very hard to help the most vulnerable people in my city. Besides of that, of course, we are facing the challenges of this century. We have to remember that Uruguay have an electric mix of 97 renewable energy, and that we have every night excess of energy, and that Uruguay in the past years has developed a very strong change in our telecommunication mix, as at the point that we have 85% of the homes connected to the internet, which has been very important during the pandemic. And more than 60% of the homes are connected directly with fiber optics. So for us, in the city, these two things are at least basis in order to continue working for electric mobility, continue working for a smart city. And now we are working with our scientists, with our national university, in the many problems and opportunities that Montevideo has. Honoring our tradition, we are working in many cases with the edge of science for issues concerning health and concerning the well-being of our people. So we are doing many things in the health area, but also in, as I said before, in terms of food, in terms of good conditions for housing, in terms of trying to help to reactivate the economy with the works that Montevideo needs. So thanks for giving me this opportunity to share with you all our work. And for us, it's very important to listen to you, to hear your experience and your knowledge in this terrible moment that the humanity is living, because we are convinced that we really have to go through a collective road, and we are convinced that cooperation is, as never, very important to all of us.
Well, thank you for giving us such a good insight into your city and also of the many other factors at play that will play into the rollout of vaccines as far as COVID is concerned, and the other health inequities that are at play within your city. And I wonder, Mayor Lightfoot, whether you can point to similar kind of local health inequities and problems that are pre-existing pre-pandemic that have exacerbated the challenges around COVID-19 and a vaccine response.
Well, I will just say that a lot of what the intendant said absolutely resonates with me here in Chicago. We are a city that's about a third white, a third Black, a third Latinx. And our Black and Latinx communities have been significantly plagued for a long time by health inequities. We have life expectancy gaps in some instances between Black and white Chicagoans of 10 to 12 years or more, depending on the neighborhood. We don't have enough of our people of color really connected up to care, healthcare, having a regular relationship with a physician or nurse practitioner. And so those are some of the challenges that we face. And as you know, this virus exploits people who have underlying healthcare conditions. And that is true across Black and brown Chicago. And I'll just dig down into one of the things that I said before. When we found out in early April of 2020, that this disease was disproportionately impacting Black and brown Chicago, I said to my team at that time, we need to dig into this. We can't look away, but we also can't do temporary Band-Aid solutions. And so we formed this racial equity rapid response team that partners us up with community healthcare organizations that had already been working on a number of these issues. We follow the data and really surge resources and outreach into areas where we're seeing the highest mortality rates, the highest rate of infections. We open that table up later to address the Latinx community's challenges through COVID. And we have now formed a network and a partnership across the city that has served us well as we've been dealing with vaccine rollout. Vaccine hesitancy is also high. The same people who are getting the sickest are the most at risk. We found through our surveys were the least likely to be willing to take the vaccine. We've turned these numbers around. Go ahead, jump in.
No, I was just going to ask you specifically about the program that you were just talking about. Is this the dashboard, which that sort of is helping to visually communicate data to yes. Chicagoans? I'm really interested if you could explain that to us, because I think it's one of those policies that could perhaps be rolled out elsewhere with similar success.
Yeah, that is one of the tools that we knew was important. People wanted to understand, they wanted data, they wanted to be able to really follow and understand the arc of this pandemic real time. So we have created a number of different data based tools, which are updated literally daily. We have a COVID dashboard that tracks cases, percent positivity, testing, infection rates, hospitalizations in ICUs, the number of people on ventilators across our city. So the same information I get and the metrics I track with our public health officials are made available to members of the public. And I think that that's been reassuring. Another thing that our public health commissioner started and now continues is going on Facebook Live. We call it The Doctor is In. And she fielded real-time questions from residents who are concerned about COVID. We've now expanded that, and we have that being done in Spanish as well. So we know that the only way that we're going to calm people's fears and educate them about the things that they can do to protect themselves is being 100% transparent, but meeting them where they are in the moment, using trusted community partners. And that has served us well here in Chicago. We certainly haven't solved every problem in 1 year, but I think we've really laid a very robust foundation for addressing these larger systemic healthcare inequities going forward.
And vaccine hesitancy, Mayor Lightfoot, you just mentioned it then as well. I mean, these are the sort of the tools that you've talked about, this dashboard, for example, is the sort of thing that really instills confidence in a nervous population at the moment. And I'm wondering, Intendant José, whether you've found that vaccine hesitancy is a problem, a challenge within Montevideo. And if it is, then how are you combating that and trying to instill that confidence in people?
Well, you know, Uruguay has a long tradition in vaccination. So at the beginning, perhaps some fear in the population, but we received an important quantity of vaccines initially from China. And now we have more people wanting to be vaccinated than the vaccines that we have. So I think that this is not a problem right now. We are trying to help in our polyclinics that we are opening positions to help people to I don't know the word in English, to schedule a day and a time to be vaccinated, because many people, mainly people of more than 70 years, for example, is not very, I don't know the word, it's not very easy for them to access the web in order to schedule a day and a time to be vaccinated. So we're trying to help older people to that. We also open a phone line for the people older than 70 or so, in order for them to call and to help them, to help them in many things. For example, what is wrong, what is not concerning COVID, how to make the schedule, and in many cases, just listening. Because we are living in a moment in which physical distance is important in order for us to protect everyone. But I think that the political persons as me has the responsibility that this physical distance not to turn to social distance. Mm-hmm. You know what I mean?
I do know what you mean, yes. Yeah, and I know that Montevideo, you have managed to roll out very successful public communication campaigns when it comes to health. And it seems to me, from what you've been saying, is that it's quite a holistic approach to health as well. Yeah. You're talking about housing and inequity across the board as well, and where vaccine hesitancy is an issue as well. It seems like it's in the age of misinformation, it's just about reassuring people and giving them the authentic, honest facts as they are.
Of course. I think we are living in a world, a very complex problem, and there's not only one solution. Vaccination is very, very important. Without vaccination, it's impossible, but it's not enough. So yes, I think we have to develop an holistic solution, and not only from one institution, not only from the city, of course, for the university, from the universities, from the workers, from the political parties. We have to really be all together, putting solutions on the table.
And I mean, in terms of the partnerships then and cooperation, collaboration, whether it's with national governments or with private sector partners or just individual community groups, Mayor Lightfoot, have you found that that's been a really crucial element in terms of moving forward with a strategy for getting over the pandemic? Have you found that you've learned a lot perhaps from your peers or from other organizations, other countries, other cities?
Well, look, there's no playbook for any of us on how to manage in the time of a pandemic, is an historic economic meltdown, civic uprising, on and on and on. There's just no playbook for this. But the one thing that I think has really served us well is the word that you hit on, and that's partnerships. Throughout this pandemic, there's a lot of lessons learned, and I'm sure some that I'll be thinking about for the rest of my life. But one thing that's very clear is you understand the force of power that you have as a local leader, but you also become very painfully aware of the limitations in that power. And I think the things that we can do well is be conveners of conversations, resources, collaborations. And that's where I think our strength is. And then bringing resources to the table and then inviting others to replicate that. But really, I think the mayors have to be the center of gravity for what's happening, but bringing other people to the table that are necessary to really move things. On vaccine hesitancy, for example, we've done everything from celebrities talking about vaccines, athletes, entertainers, but really where we've gotten the most traction is people seeing folks in their neighborhood, in their network who have gotten it and realize, oh, it's actually safe. That has been the game changer. And that comes through really creating community ambassadors to go and talk to their neighbors about these really important critical issues. That is a huge takeaway for us here in Chicago.
It's all about the reassurance, really, isn't it? I mean, all of us are feeling so vulnerable over the last year. So to have that reassurance that this is safe, that this is a step forward, is really positive. Intendant José, you were going to add, I think, to what Mayor Lightfoot was saying then about partnerships.
Yes, first, I agree with every concept that Mayor Lori is saying, really. I imagine the challenges she's facing, and I wish her all the luck she can find, because luck always is good. But yes, I agree. And what I am going to say is that really collaboration, but real collaboration, transparent, a clear message to the people is very important. Putting ideas, concrete ideas on the table is very important. We have to deal with many things, with mobility, with cleaning of the city, in fact, with the future of the city. And we really need a lot of work together with the social actors from the science, educators, the unions, the chambers, the chambers of companies too. We have to sit together and work on solutions, because the problem is complex. It's not only one solution. So we have to face a complete set of things that configure a solution. So yes, and the people want to collaborate. The people want to collaborate. We have been living, for example, donation of bread, donation of food, huge amounts of donation. And in this uncertainty, if we give the people the way to be useful, we also are shortening the social distance. So really, we have to collaborate.
It's so fascinating.
I think I can pick up on one point.
Absolutely.
That Attendant Costa made. She said this several times, and I just really want to lift it up. There is not a single solution to this incredibly complex and multifaceted problem. I agree with that 100%. It's not enough just to vaccinate. It's not enough just to educate people. It's not enough just to connect them up to the healthcare system. It's got to be all of those things operating at the same time and more.
Yeah. And I think it's fascinating what you're both saying about collaboration as well from the grassroots level. So not just the elected officials or leaders, but actually people feel quite helpless at the moment. And knowing that there's collaboration at all stages of this response, it is so crucial. And Mayor Lightfoot, let me ask you first, and then Intendant José, I'll come to you afterwards. I wonder if there's one piece of advice that you could give to perhaps other city mayors, city leaders as well, who are tackling COVID right now, in terms of, you mentioned at the very beginning about the fact that this pandemic is changing course quite often, that COVID-19 cases are currently sort of making a bit of a comeback in various parts of your city right now. Is there some particular piece of advice that you wish you had known at the beginning?
Well, that's a great question. I guess I would say a couple things. Number one is be prepared. The reason that we have been able to be nimble in really providing a robust response is because our Department of Public Health has been prepared and continues to be prepared for years. You remember the early days of this pandemic where people were flying suitcases of money to far-flung places to find PPE, masks, ventilators. We didn't have that struggle in Chicago because our Department of Public Health was prepared all along. That diligence and preparation and building out a robust public health structure, we have been so fortunate and didn't have the challenges that a lot of other places did. But I guess the other thing that I would say is follow the data, follow the data, follow the data, and be transparent about why you're making the decisions that you're making. Look, people have been carrying a lot of burdens over this last year. We have upended, because we were trying to protect people's lives, we've upended the certainty of what today will be and tomorrow will be. And I think the only way that people have been able to really socialize it and tolerate it without rebelling in the way that we've seen in other parts of the world is because we've told them the truth. We treated people like adults, and we've done it with data and science. And that you cannot over communicate in the middle of a pandemic. There's no such thing. Communications, collaboration, and transparency is critically important, as well as preparation.
And Intendant José, I want to make sure that we have enough time for the Q&A because there are questions flooding into both of you. But if I can ask you the same question then, if you have a golden piece of advice for your peers within the mayoral world.
First, couldn't agree more with the Mayor Lori. I would add a little thing. She said, be prepared. I agree completely. I should add, first, the solution is complex, but the solution is not in the main office. Go out, stay with the people, with all the people, with the more vulnerable people, listen carefully. And also be prepared, because the pandemic is not the only thing that is happening in the world in this moment. We are living the greater revolution in the working world. Works are changing. And this is very important because pandemic is destroying works, destroying jobs. And at the same time, there's a huge revolution in the working world. So be with the people, be prepared, be innovative, work side by side with science, with education, in order to help people to go through this pandemic, but to go through also these very difficult times for the shops. That is part of the health too. So this is the thing I would add.
That's really good advice and practical advice. I think, as well, which is so useful. Please, both of you stay on the line, because we are going to get to the Q&A section now. Just as a reminder, you can use the Q&A button at the bottom of your screen and you can pose questions. We'll try to get to as many as possible. You can also use the hashtag Vital Talks on Twitter if you wish to pose a question. So first question that has come in is, how are your cities managing misinformation about vaccines in your municipalities? Mayor Lightfoot, if I could come to you first.
As I said, we have really tried to be incredibly robust. Our public health commissioner is out and public. Our doctor is in series in English and Spanish. I think it's helped. And also our messaging. We've used our social media channels. And then again, that partnership with local healthcare providers, whether it's individual doctors or community clinics, but also we've educated a huge number of community stakeholders. We have a massive contact tracing team that also is pushing out information. So we've had from the very beginning a very robust community engagement and public education campaign. And you're right, we're fighting against a lot of misinformation that's out there, but I feel like our messaging is breaking through, and that's a critical part. Separating out the facts and the data from the noise. Not easy in this time of social media, but essential so that people really understand. And again, getting those trusted community ambassadors and stakeholders invaluable in this effort.
Yeah, it seems that communication, clear and repetitive communication, seems to be the key here. So Intendant José, the same question to you then. How are you managing misinformation and I guess perhaps some vaccine hesitancy as well within Montevideo?
Every time that we announce anything about the city, we gave to the announcement the framework of the situation right now concerning new cases, concerning anything that is important to have the whole picture. And now we have a policy of open data. We have open mobility data and cleaning data, and also we are grouping the data from Montevideo, and we are going to publish them because national government is publishing data for all the country.
Okay, I understand. Thank you. This next question then is for Mayor Lightfoot. The question reads, as we remain hopeful towards the end of this pandemic, very hopeful, of course, what steps are you taking to build health capacity for the future?
Well, it goes to some of the things that I said in my earlier remarks. You know, we wanted to make sure that we were taking on the biggest challenges that are out there. The lack of access to quality healthcare, a lot of misinformation about that. And we've done that through these partnerships and these community-based tables that have been built, whether it's under the auspices of our Racial Equity Rapid Response Team or in some other means in which we're reaching deep into the community. And then we've been putting resources into communities to build a real robust community healthcare worker network that will carry us forward past the pandemic. But fundamentally, it's about outreach, it's about listening, it's about meeting community needs. If I can share just this quick anecdote, we went into one of communities expecting that the biggest concern was going to be COVID. It wasn't. It was hunger and making sure that people had access to food. So we have learned a lot by listening and not going in with a lot of presumptions and then responding to what the community needs. When you establish that legitimacy and that trust, then you can move in other directions. But you can only move at the speed of trust. And that is a valuable lesson for us.
Okay, next question then is for Intendant José. In what ways have your efforts at fighting COVID been assisted by your existing efforts and infrastructure aimed at preventing non-communicable diseases?
Well, for example, we have created a fund in order that the people that go to our polyclinics can buy the medicines to fight against these non-communicable diseases, for example, because, you know, health is a national competency, but we have local polyclinics. And one of the things we are deeply learned is the importance to be local, mainly in the neighborhoods more vulnerable, and then to be local perhaps is the thing they are going to strengthen in the near future.
Okay, so the next question then is for Mayor Lightfoot. You mentioned Johnson & Johnson before, and this question speaks straight to that. Are you concerned then that the Johnson & Johnson pause will affect vaccine equity in your city?
I am concerned because the federal government here had been placed a lot of emphasis on Johnson & Johnson, and that was the increased supply of vaccine that we were getting week over week. And we've had to pivot this week because we had a lot of very big max vaccination sites that were going to be heavily dependent upon Johnson & Johnson. So we've had to make the necessary adjustments. My hope is that our federal government, the FDA, and the CDC will learn the lessons of the EU's experience with AstraZeneca. There was too much back and forth from my vantage point regarding, is AstraZeneca safe or is it not safe? And it really, I think, eroded people's confidence. What we have here in the US is 6 cases out of almost 7 million doses administered. Absolutely, the system is working so that the FDA is being cautious, but I want to make sure from a messaging and engagement standpoint, they really are being mindful of what happened in the EU because we had built a distribution plan, and I say here in Chicago, but I think this is true across the country, in which J&J was going to be a huge part of that effort. If that's not available, then we all are going to be in a difficult set of circumstances.
And just more broadly speaking, Mayor Lightfoot, if I may ask, how has your city worked with federal government then and with the likes of the FDA and CDC? I mean, has it been a productive partnership in that sense? Well,
I will say with all candor, it's different since January 20th than it was before January 20th. So the inauguration of the new administration has been like a breath of fresh air. We are communicating on a regular basis. They care about cities. They want to make sure that they're providing us with resources and support because they know the larger federal plans are executed at the local level. And particularly in big cities like Chicago, where we've got a robust and very challenging set of circumstances and a diverse population, we have to all be on the same page and coordinated. And their partnership has made all the difference. We now get a 3-week look ahead, as before we literally didn't know from week to week what we were getting. It's night and day, and the line of communication has been phenomenal, but we all need more vaccine.
Intendant José, question for you. What public health lessons will you take away from your city's COVID response?
Well, the importance to be local is one lesson. Then the importance to prevent, to have a planification, the importance of to be very clear with the communications, because in many cases, we see that the people really didn't know what to do. Didn't know what to do when symptoms appear, or didn't know where to go. So helping in that area for us is very important. We are trying to help with the national government in these areas. We have a public TV channel of the city, and in this channel we give a voice to the scientists that are working in new methods to prevent and to treat the disease. And we are being very focused and systematic with this. Mainly every day we give voice to one scientist in the channel, in our city channel. So the lessons is that health is many things. Uruguay had a very strong health system that was built in the former periods of government, a health system that mainly assures universal access to health. And this is one of the fundamentals over which this pandemic is crossing my country. But a system has a limit, as everything. So health is many, many more things. You know, Tabaré Vázquez said, a disease is a matter for a doctor, for a physician. But health is a matter of the state.
Yeah.
So really health is many things. And the lessons is first, the value of scientific research, the value of public education, the value to invest in infrastructure today for the future, because the future is not only the great things that you want. Future also is risk. And pandemic is a demonstration that what important is to be prepared to the future. Because future many times could be bad news, like this case. So these are the main lessons, I think.
And the same question to you then, Mayor Lightfoot, the public health takeaways that you will that will stay with you as you continue on with your term, and hopefully when COVID is behind us, what will you take from what you've learned and try to adapt elsewhere?
Well, there are many, and but I will try to summarize them. As I said before, preparation is key. You've got to prepare every day, every month, every year, and be ready. Particularly in a city like Chicago, we have people coming to us from all over the world, and we've got to make sure that our public health infrastructure really is ready to support and click into action. One of the things that I think is also going to be an important takeaway for us as a city, we have seen a level of coordination and collaboration among our healthcare systems, particularly our hospitals, that we've never really seen before. Hospitals, particularly for-profit, are in competition with each other normally, but we've seen cooperation between them with our safety net hospitals. So those are the hospitals who are not-for-profit that attend to pour in the most vulnerable, a level of collaboration across the entire system that we want to make sure that we continue to promote. And then finally, a big takeaway is we've got to keep nourishing this community-based healthcare system and network that we've really placed a lot of emphasis on through this pandemic. This is what's really going to save people's lives and bring real equity to the healthcare system going forward.
We are so grateful to both of you for the efforts that you've made so far and for sharing your time today. You're obviously both so busy and in the middle of this ongoing crisis. So we're very, very grateful to Mayor Lori Lightfoot of Chicago and Intendant Carolina José of Montevideo. Thank you to you both. Now, as we near the end of this discussion, I would like to not only just thank today's speakers who we've just been hearing from for their time and insight, but also a big thank you to the Partnership for Healthy Cities, to Bloomberg Philanthropies, and to the World Health Organization, and of course to Vital Strategies. I'd also like to extend a very warm thank you to our audience for your participation and for what's been, I think, a really dynamic Q&A. Loads of questions. My apologies for not being able to get through all of them. Such is the nature of a Zoom call, which is our life at the moment. We don't get to absolutely everything, but I'm sure the team at Vital Strategies will be happy to pass on questions and get back to you. To watch the recording of this event or to learn more indeed about the Partnership for Healthy Cities, please do visit vitalstrategies.org or visit @VitalStrat on Twitter. My name's Hannah Vaughan-Jones. It's been a real pleasure to be with you today. Thank you so much for joining us.
Thank you very much.